Hi Henry, how are you?
I'm okay, Vate. How are you?
Good, good, good,
Yes,
good. So I
yes.
noticed we focus more on treatment modalities and how to improve outcomes of treatment in cancer and
Hmm.
forget the basics,
Hmm.
prevention.
Prevention of cancer.
How would you best teach a layman, someone without medical background about cancer? What is cancer? Let's start
Uh,
off from there.
Basically, cancer is like abnormal proliferation of body
What
cells.
is proliferation?
Proliferation
For
is
someone
like
like me that knows plus one, plus two, minus two,
uh,
you know?
so proliferation is like multiplication of body cells. So you
Times
realize
one,
that our
times two.
bodies are made of cells.
Mm-hmm.
Like you see, a house is made of bricks. So our bodies are
Mm.
made of cells
There
which
are
come
building blocks.
exactly which come
Mm-hmm.
together to form tissues.
Mm-hmm.
Tissues form organs.
Uh-huh.
So, in our nature, a
Mm.
body makes new cells all the
Mm.
time,
Mm-hmm.
as well as some cells die off. So,
Mm.
what happens in cancer is that there are many cells that are produced very fast, and
Mm.
yet very few are dying off. So, these abnormal
Mm.
cells are what you call cancer. Yes.
Oh, what makes them abnormal?
First of all,
They're not
yes.
built like the cells in your body. What
Um,
makes them abnormal?
it really depends on which type of cell, but most of the time they're immature.
Mm.
There are cells that don't die even when their life expectancy reaches. Maybe a cell is supposed to live there for 120 days.
Mm.
That time can come and that cell doesn't die. They
Mm.
have some abnormal structures. Their genetic material is abnormal.
Mm.
So they're really abnormal in structure and function. Even the work they do is also abnormal.
Yeah.
Hmm.
So you mentioned that these are abnormal cells, different
Hmm.
from the cells that do our body's makeup.
Hmm.
Not makeup, the makeup by the way. Abnormal
Lipstick.
cells different
Yeah.
from the genetic makeup that we are supposed to have, and they have abnormal function. What are some of the abnormal functions of these cells?
Okay, so each cell in the body has a different function from another. Okay,
Mm-hmm.
I might mention, for instance, white blood cells. Their
Mm.
role is to prevent us from getting diseases and
Mm-hmm.
fighting off diseases.
Mm.
So if somebody has cancer that affects white blood cells,
Mm.
that function will no longer be possible.
What type of cancer is that, for
So, for
example?
instance, that can be a leukemia.
Mm-hmm.
Okay, maybe cancers that can affect the bone marrow, cancers that can
Mm.
affect the bloodline, like
Mm.
leukemias. These are also quite different types of leukemias. There are those which
Mm.
are acute myeloid leukemias, chronic myeloid
Mm.
leukemias. There are also those which are lymphocytic. So there are different types of cancers, and
Mm.
almost each cell in the body at some point can be at risk. Each cell in the body can actually get cancer.
Mm. So you
At the moment,
mentioned risk and then abnormal function.
exactly.
Okay.
Yeah.
So, what are different causes of cancer? What can cause your cells, the normal cells that
Mm.
you're made with, to be at risk of turning into cancerous cells and multiplying into cancerous cells that do not die off in the lifespan within which we expect normal body cells to
Mm.
die off? What are
Okay.
the different causes?
Okay, so to approach that question of causes, actually, I think we should also approach it with prevention because
Mm.
usually when you know the cause, you can even prevent it. So we
Mm.
can address the possible causes of cancer and then maybe how do we prevent them. So the causes of cancer are quite many, quite many.
Mm.
They range from infections. You know that there's some infections that can actually cause cancer,
Like which ones?
like viral infections, some viral
Which viral
infections.
infections? You want to tell me
Um,
even flu,
no,
coronavirus?
not really. But for instance, if someone is having HIV infection, there's some
Mm.
cancers that they are predisposed to.
HIV infection with high viral load or suppressed. We need to get
Uh,
this right.
of course, usually if you have a high viral load and maybe you
Mm.
are not well suppressed, there's some
Mm.
cancers that you are likely to get,
So
like
viral load and its suppression is what is important to an
exactly,
HIV patient. It is
exactly,
not a guarantee that being HIV positive predisposes you to growing cancer cells. Okay,
exactly.
I think you got that right.
Yes, and then
Yes.
also there's some other viruses like the human herpes virus.
Mm.
The quite a number of viruses, the Epstein-Barr viruses. So when you have these viruses, your chances of getting cancer are quite high.
Mm.
So apart from the infections, of course, how do we prevent those infections? Most of these actually are preventable. Like HIV is preventable. Our usual
Mm.
ABC, okay, and then maybe if you have HIV, you should take your medicines
Mm.
religiously so that you don't get to that level where you are virally unsuppressed.
Mm.
So some of the other infections can actually be vaccinated against. Okay, I think you've heard
Mm.
about campaigns like cervical cancer screening and
Mm.
vaccinating girl children.
Speaking of cervical cancer and how
Yes.
rampant it is, how can it be prevented?
Exactly. So one of the
Minus the vaccine.
Okay, of course, vaccine is number one.
Yes, it's
Two,
number one.
we must avoid multiple sexual partners.
Mm.
Most of our girls can have 5 different boyfriends. One for hair, one for food, one for salon, one for everything.
Jesus is Lord!
And the boys can't have 5 different girlfriends. For which purpose?
Yes, so those social networks actually, people can easily get those viruses that can predispose them to getting cervical cancer. Talking about other causes and how we can prevent them, things like smoking. Okay, like smoking.
How does smoking predispose one to getting cancer?
So there are some cancers, especially those of the respiratory tract, the system that we use to breathe, the lung cancers. Studies have shown that people who smoke, be it cigarette or any other things, they are usually at higher risk.
Inclusive?
Exactly. And
I mean the inclusive for our local
exactly.
people?
Come again.
Cooking with firewood?
Actually, firewood we consider it to be a biomass.
Really?
Biomass, yeah. So there are biomasses, different biomasses apart from exposure to firewood, exposure to cow dung, okay, exposure to too much smoke. So most of these also predispose people to getting some of the cancers.
Okay.
So, and for these ones, how do we avoid them? Basically, if you can know the cause, avoid it. Okay, if you know that exposure to smoking can predispose you to cancers, avoid the smoking. So smoking cessation is encouraged. People encouraged. Those who have not started smoking, don't try. Those who are smoking, try to reduce and if possible, get away from it. From smoking, we should also talk about alcohol. Do you know that alcohol can also predispose you to some types of cancers?
Oh, tell me how.
There are some which are direct and others are indirect.
What are the direct ones?
So direct ones, for example, give you about the liver disease. Okay, so alcohol, like people who have consumed alcohol for a long period of time and in too much quantities, they are at risk of getting liver diseases that can culminate into liver cancer. I think you've heard about things like hepatocellular cancer. That is like the cancer of the liver. It happens when people have been having alcohol for long periods of time and in too much quantities. So alcohol can actually predispose somebody to cancer, especially too much alcohol. And how do we avoid
how
that?
much is too much? Let's start off from there.
Actually,
too much can be relative, by the way.
Yes,
so how much
yes.
is too much?
Actually,
any scales or scores backed up by science that one can refer to and they're like, this is too much?
Okay. So there are actually well calculated units somebody should take. I don't know if I'll be able to translate these units into our settings. I've seen the whites do it, but they'll say that for a woman, you need about 13 units in a week of alcohol. A man about 14
what
units.
concentration is in 1 unit?
Yes, how these ones exactly translate into our settings, I really don't know. But basically, maximum, if you are to take alcohol, it should be like 1 glass of wine a day. So if you go beyond this, or you're a binge drinker, do you know binge drinkers?
No, you can teach me. Tell me
binge
about
drinkers,
it.
Yes, binge drinkers are people.
And maybe binge drinking water. You can tell me
not water. But basically, binge drinkers are those people that don't usually take alcohol, but the moment they get a chance to take alcohol, they take too much of it. Okay, so someone maybe has not taken alcohol in a whole week, and he has maybe some rich man is buying alcohol for everyone.
So a rich friend's a problem.
Rich friend who is constructive.
A rich friend's a predisposing factor. Let's also start from there.
A rich friend who buys you alcohol once in a while and wants to take a whole crate in just one night is not a good friend.
The rich friend or your appetite? Which is which?
I don't think alcohol has appetite. But anyway, the whole point of it is alcohol can actually predispose one to cancer. So you should, as much as possible, avoid alcohol.
Avoid drinking.
Yes. Okay. Apart from alcohol, there are quite some other things which can predispose people to cancer. Physical inactivity. These are people who don't ever exercise.
How much activity is enough physical activity?
To start with, there are those who don't even do an activity at all. Those ones are more at risk. Then, so those ones, at least they need to start doing some activity. If you use your car all the time, using a lift, you're seated, at least you need to start doing some physical activity.
Sometimes after every how long within the day?
It would have been best if you could, at least every day, get at least some 30 minutes of exercise.
Okay.
Exercise that can make you sweat, okay? You can run around, you can walk. You can always make sure that your body is active. It helps with preventing cancers, and also it helps you feel good. Each time you exercise, there are some chemicals which are released. They're called endorphins. These endorphins make us feel good, and it somehow helps with preventing cancers. Okay. Ask again.
Okay, so you mentioned alcohol use, excessive alcohol use, sedentary lifestyle and physical inactivity, obesity and being overweight, smoking, multiple sexual partners, and risk of certain viral infections being the risk factors for one developing cancer.
Yeah.
So for someone that hasn't done all those and they're like, checked, ticked off safe, what other factors can contribute to risk of cancers?
So the diet, what we eat, actually, food is medicine. It's medicine in a way that it can even help you prevent some diseases.
Okay.
That's why we encourage to our people to always take a balanced diet. So a balanced diet that has carbohydrates, proteins, vitamins, there are greens, there's water. Chances are high that you'll be able to get most of the nutrients that your body needs, and also to fight off some of the cancers. We have what we call antioxidants. Okay, these are mainly in mostly in fruits. Okay, most of the fruits at least contain some antioxidants. So these help in removing some of these toxic products that accumulate. Sometimes we take medicine, sometimes we're exposed to chemicals, sometimes these are generated within the body.
Talk about
yeah.
Fumes from exhaust pipes.
Exactly. So fumes from exhaust pipes,
fuel,
industries,
burning petrol, burning kerosene.
Exactly. So most of these can actually put our bodies at risk. So at any time too, we need antioxidants. These are like cleansers, things which can clean our bodies and remove some of these oxidants. And that's where good diet comes in. So encourage our people always take good diet, balanced diet. Make sure that almost all the food components are there.
So speaking of toxins, you said some of them can be from your environment.
Yes.
Some of them can be from what you're exposed to. Some of them can be from drugs you're taking or things adulterating your body.
Yes.
What environmental toxins are to take note of?
Chemicals, most of the times, chemicals. And in our day-to-day lives, we're exposed to chemicals almost all the time. From what we eat, okay, from where we get our water. Is our water safe? Sometimes you find that the place where you pick your water from is the place where someone who grows their tomatoes, when the rain washes, it all ends into the well where people pick their water from.
Organophosphate
so you can easily get
water.
organophosphate poisoning. You can always get poisoning from the industry, the people who live maybe near industries, and the fumes are produced, a lot of chemicals are produced. So these are washed
and channeled into water.
Yes. So most of these put us at risk. And also there are radiations. Okay, radiations can be quite many. I think most people have heard about X-ray radiations, ultraviolet radiation, but there's so many hundreds of radiations. All these put people at risk of developing cancer. So the best way
a radiologist is at risk of developing cancer from their job or protective equipment. We want to know what does what.
Okay.
Being exposed to radiation or radiation without protection?
Actually, being exposed to radiations without protection is what causes to cancer.
Okay, so a radiologist is not at risk of cancer.
Somehow they are at risk. So
even with protective gear,
of course,
and lead apron,
you're safe. Okay, but without it, you are at risk. Not just radiologists, but even the whole environment. Okay, that's why where they're putting an X-ray machine, there's some recommended maybe width of the building. You've heard about what they call a lead coating. Sometimes they put measures to ensure that these radiations don't get into direct contact with the public and also with the people, so that they minimize the radiations, and by that they are minimizing cancer. Yes.
Okay. Such a wonderful chat. I think next time I'd like to learn more about the different types of cancers in detail and causative agents that are specific to those types of cancers.
Actually, we can
explain this paradox and increase awareness.
Sure.
That was nice.
Thank you very much for hosting me.